On my right, I have Dr. Loche Johnson. Welcome, Loche, and I look forward to our discussion today.
Thanks, Steve. Thanks for the opportunity to explain some of the aspects of oral and maxillofacial surgery as they relate to the dental field.
Thank you. So, Loche, let me ask you, what is general anesthesia as opposed to local, and what would make a patient a candidate for general anesthesia?
Steve, general anesthetic is administering medications such that you alter the level of consciousness of a patient so that they are basically rendered unconscious. They may be arousable to a specific stimulus, pain or ammonia salts, but to a point where you can do a procedure such that you've completely removed any anxiety or and lower their threshold so that they don't feel things nearly as much. Now, whereas a local anesthetic is basically where you're just altering the nerve function specifically at the location that you're doing your procedure, so that basically you're not allowing the impulse from the area to reach the brain. However, you're not changing the level of consciousness of the patient. Frequently, patients are very nervous or anxious, as I'm sure you know about visiting the dentist. And specifically, they're very nervous and anxious about having an oral surgical procedure, either be it a removal of a tooth or an implant or any type of single tooth extraction. And depending on that anxiety, to help them cope with their I don't know how you specifically call it, their discomfort as far as coming to an oral surgeon. We can render them an anesthetic, starting an IV, giving them medications that depresses their level of consciousness, in addition to using a local anesthetic while they're asleep, so that when the procedures finish, they are comfortable and frequently don't even know that the procedure has been started. And it makes it very comfortable for third molar removals. Kids have very anxious, very nervous about going to the oral surgeon, and therefore frequently just doing multiple primary teeth extractions will use an anesthetic to try to help the little ones get through it. And then there are a lot of dental phobics out there that just rather not have to go through a procedure with a local anesthetic, and therefore we're able to give them procedures such that is tolerable and gets them through it without too much of a detriment.
Do they need to worry about complications if they ask for general anesthetic?
Yeah, most people do ask about the possible risk of complications related to a general anesthetic. And how I usually explain it to them is that as long as they're NPO, meaning that they haven't had anything to eat or drink for 8 hours prior, and they have a ride because they won't be able to drive afterwards, that they're going to be in great shape. There's probably more risk from not doing a general anesthetic on a lot of patients because of the fact that they may not tolerate the procedure halfway through the procedure, where they'll get into an anxiety or panic attack. And really the risk of just having a car accident on the way over to the office is greater than the risk of the actual anesthetic itself.
Good. And how about additional cost to the procedure if they go with general?
It is an additional cost. If it's a warranted procedure, such as a third molar removal and or multiple extractions or dental alveolar where tori are being removed, those are bony growths inside the mouth that need to be removed. Frequently the insurance companies will cover their portion of their obligation, and then leaving the patient anywhere from 10 to 20% responsibility for the actual anesthetic. So as long as the patient has insurance, the out-of-pocket is no more than $30 to $40 for a general anesthetic to the patient for the anesthetic. However, without any insurance coverage, the anesthetic cost is anywhere from $300 to $320 for the anesthetic.
All right. Well, I want to thank both you, Dr. Johnson and Dr. Phelps, for joining me today.
Thanks, Steve.
And for sharing your expertise with me and with our watchers out there. And I want to thank all of you for joining us today. I hope you found this discussion useful. I'd like to encourage you to check out more of my videos at www.totellthetooth.com. Please also check out my office website for general dentistry at www.toothhaven.com. Until then, this is Dr. Stephen Brazis wishing you all the best of oral and general health.